Welcome to Women's Health Minutes, a podcast series brought to you by the American College of Osteopathic Obstetricians and Gynecologists. The opinions expressed are those of our speakers and may not reflect those of our sponsors. This podcast is not intended to replace professional medical advice. We hope you enjoy our presentation today. Thanks for listening.
All right, everyone. Welcome back to another episode of our podcast. I am delighted to have Dr. Sarah McCormick with me to speak a little bit about exercise and pregnancy. Welcome. Thank you for joining us.
Yeah, thank you so much for having me on. I'm so excited to talk about my favorite topic.
So we know each other going back a little bit, but why don't you introduce yourself to the audience?
Oh, yeah, so I'm Dr. Sarah McCormick. I am a DO practicing out of Midwest Center for Women's Health in the Northwest Chicago suburbs. I've actually been in the Northwest suburbs for about 12 years practicing medicine. I am a triathlete, runner, swimmer, weightlifter. I competed in bodybuilding. And so when I became pregnant, working out just became a big thing I wanted to know more information about. So that's how this all started.
That's great. So let's jump in. Why don't we start by defining what exercise is?
I like to start with definitions. Everyone needs to know. So we have two definitions of exercise in pregnancy. We have aerobic exercise in pregnancy. So that's going to be your rhythmic, continuous activity using large muscles. They raise your heart rate, breathing, improve the efficacy of your heart and lungs and blood vessels in delivering oxygen. And then we have resistance training. That's a form of exercise using external resistance to challenge muscles. Build strength and size and power. Exercise in general is just a physical activity consisting of planned, structured, repetitive bodily movements done to improve one or more components of physical fitness.
So I don't think we have a great percentage of pregnant women exercising, but can you tell us a little bit about why they should and the benefits?
Yeah, so currently we really only have about 16% of women pregnant in pregnancy exercising. So we definitely need to increase that rate. But with the studies that have been done, we've actually found that we have decreased C-section rates up to 15 to 36% with exercise. Women gain less weight in pregnancy. We have improved glucose levels in our diabetic patients. We have decreased rates of operative deliveries, forceps, vacuums. Actually, decreased rates of preterm birth, which a lot of people thought would be opposite, but it's not. Less fetal macrosomia. We actually improve maternal anxiety and depression scores. We actually reduce the risk of preeclampsia and hypertensive and pregnancy disorders, decreased risk of gestational diabetes, higher vaginal delivery rate. We actually have improved postpartum recovery times and actually decreased musculoskeletal pain and disability. Tell my ladies complaining of back pain to go do some yoga.
Yeah, that's great. I think there's not a lot of education that happens for us as physicians. And so I think there's just a hesitancy sometimes for providers to encourage women to exercise, or it's more like just go for a walk or very low impact type stuff.
Yeah, and I've had people when I was pregnant tell me not to exercise or not to. So
I was going to ask you about that
so
because
bad.
I think there's women and they've maybe had just anxiety or miscarriages, and we talked about that in your webinar, but just some people that just feel like anything they do is going to increase their risk of miscarrying.
Yeah, and there is some data. I don't have the exact percentage in front of me. There is some data about like vigorous exercise when you're trying to get pregnant or early pregnancy. So we really shouldn't be doing that. But as for like light to moderate activity, exercise, it's okay. Up to 12 weeks, we really don't want to do anything vigorous or heavy lifting or anything. But then after that, we do have studies and been tolerated well.
So what are some contraindications for women to like not exercise?
Well, I think as OB-GYNs, they're kind of self-explanatory, but basically anyone who's like has heart, lung disease, anyone who's got thin cervix, incompetent cervix, they have a cerclage in place. You don't want to increase the pressure on that when you're weightlifting or exercising. Full gestations, bleeding for someone with, we don't want to worsen bleed. Ruptured membranes is the other. Preeclampsia. Actually, so if you have preeclampsia or gestational hypertension that's newly diagnosed in the pregnancy, you shouldn't be exercising. But if you're chronic hypertensive or have a history of those things, you can exercise and it's fine, or severe asthma.
Okay. Can you tell us a little bit about what the current recommendations are for women to exercise? How much, how often?
Yeah, so they're currently, we recommend 150 minutes a week. And then basically, that's just of your aerobic exercise. And then for weightlifting, or I should say resistance training in pregnancy, so that can be yoga, Pilates, can be any weight, like your body weight exercises or weight training, resistant bands. That's recommended just twice a week, up to like 8 to 10 body parts twice a week in pregnancy.
How you would prescribe an
Mm.
exercise regimen for a patient that comes in like newly pregnant? Just go over like what you would ask them and how you would kind of set them up with a schedule.
Yeah, so if it's their first visit and they're only like 8 weeks, I usually tell women, we usually talk about how tough the first trimester is, and that basically, if you can do any, if you can walk or just get around, I'd say just aim for walking and being more mobile in the first trimester. And then once you're feeling better, after that 12 weeks, that's where we talk about. I usually ask them, what were they doing before for exercise? What did they enjoy doing? How long they were exercising? Basically, I'll talk to them about, let's say someone's previously a runner. So then we go into, they can continue running, but we want to keep their heart rate below about 70% of their max heart rate, or they want to be able, you want them to be able to talk while they're exercising. So that's called our talk test. And that's a good way for just the average person to figure out how hard they're exercising. So if they can hold a conversation with someone, they're probably fine. And the baby's probably doing fine with exercise. And then we really don't want to go beyond 45 minutes. If you do, then you have to do some carbohydrates so that you don't drop your sugar too fast.
I know in your webinar you also talked about body temperature. You want to comment on that?
Yeah, so we don't want our body temperature above 102.2 degrees. They found that if you exercised at a temperature, environmental temperature of 77 degrees Fahrenheit for about 60 minutes, that your body temperature stayed fine. But anyway, we're above that, we don't really know. So we don't want to go beyond an hour of exercise. But we also don't want to be in environments that are hotter than 77 degrees Fahrenheit exercising. So you don't, if you're in a terrain that's hot, 90 degrees out, you want to be inside in air conditioning exercising.
Any advice for providers on like how they can integrate recommending more exercise to patients, like just some tips for somebody who's not really advocating for it, like how you would get them started, or just some things that they can do to kind of start increasing that for their patients?
That's a good question. It's probably that 16-week visit would be a good one to just say, hey, so what are you doing for exercise? And then see what they say. If someone's not really exercising, then you just want them to start walking. You want to aim for that 150 minutes a week. So I think just asking that question helps the patient. We also know that as providers, if we recommend the exercise, then patients are more likely to do it. So that's also something you could bring up at their first visit is, hey, after 12 weeks, we really should be exercising. So it's good for you, it's good for the baby. And most women want a vaginal delivery. So if you tell them that their C-section rates decrease by 15 up to 36% with exercise, that may be a good motivation for many of them. And an hour less in labor.
Great. Another population that we have would be women that overweight or extremely overweight. Like, how do you, assuming they're interested, like, what do you modify in terms of that? Or how do you recommend they get started if they haven't been exercising, but say their BMI is 40 and they're motivated, it's their first pregnancy, they want to do everything they can? What do you advise for that set of patients?
I would say if someone is just starting to exercise but hasn't done much, I don't like to give people too much at once. I feel like it's super overwhelming and then they end up quitting because they're like, it's too much. I'm just going to quit. So I like to give people a stepwise approach. I would most likely just tell them, hey, like, what's easier for you? Is it easier to swim? Is it easier to walk? Or do you have a bike? Some of the indoor bikes, stationary bikes are good for starting, especially if you're heavier, you might have more knee pain, more favorable for them. And then I would just tell them to try to aim for that 150 minutes. And for someone who hasn't exercised a lot, 20, 30 minutes might be really daunting for them. You can always tell them, like, you can do it 5 minutes, you can do it 10 minutes. There's been multiple studies of non-pregnant women that show that exercise in little bits throughout the day has a cumulative effect that's the same as doing a 30-minute exercise. So if a lot of my desk workers say, hey, get up and walk at every hour, just do a 5-minute walk every hour. 5 minutes, 8 hours, it's 40 minutes. So they got their 40-minute workout already.
Yeah, that's a good way to break it up. So in your lecture, you talked a little bit about if somebody is exercising, what are some signs to look out for where they may want to stop exercising or discontinue?
Yeah, so a lot of them are a little self-explanatory, but obviously they're bleeding, I think their water broke or they're leaking anything. If they start having new onset shortness of breath before the activity, chest pain, pain in your calf, you worry about blood clots and things like that.
And any types of activities that you feel should be avoided in pregnancy?
Well, horseback riding. I'm right by Barrington, Illinois, and everyone has horses out here. So I have to tell them all to stop horseback riding. Big things are like contact sports, anything that's skydiving, anything that's going to have a shearing force on the placenta. I even tell patients to be careful with biking because you can fall off the bike, especially as you get more unstable. So just things to think about. Oh, the big ones we shouldn't do, definitely. And I have had someone ask me about this, is scuba diving. So we shouldn't be scuba diving because of the fetal circulation can't account for those bubbles.
Is there amount of exercise which you would say is too much?
I don't know that we have any studies. We actually don't have any studies on like marathon runners or anything in pregnancy. And it also depends. Well, I take that back. I mean, we have information on our elite athletes. I mean, these are people that are exercising like 2 to 4 hours a day. So I think it depends how they're divvying up the exercise. We know that we can exercise for up to an hour and have our core temperature be fine, but we don't know anything beyond that. So if an elite exerciser or training for something, you probably want, when you get to that hour mark, you probably just want to jump to a lower, maybe if you're running, then maybe just walk and take a little break, just because we don't have that data. So, but we do know our elite athletes have been exercising 2 to 4 hours a day and they're doing okay.
How about postpartum? Any recommendations or?
Yeah, so we have studies that show that after a vaginal delivery, women can start exercising at the 3-week mark. I've had lots of athletes, and the women who start exercising right away after birth, they always come back with prolapse. So I really caution women, like, don't get into it too fast, too hard, and we don't want to do anything vigorous right away. So walking's fine if you're feeling good, but you don't want to jump into it too fast. So 3 weeks with the studies with the vaginal delivery, they say 4 to 6 with a C-section. With C-sections, I usually encourage walking first and then weightlifting and things like that. I leave it up to the patient, but I want them to, I tell them wait 6 weeks for any weightlifting above 15 pounds, but I leave it up to them with how their incision's feeling. If they're still having pain at their incision, then I would stick to probably more just walking. Yeah.
And we didn't talk about this too much in your lecture, but how about women on the other end of spectrum where they're preconception or planning a pregnancy and they want to get in their best shape? It might be more simple, but how do you counsel those patients?
Yeah. So, there's not a lot of data women on the lower, like, honestly, I don't know the details, lower body fat. Okay. And fertility rates. So that would be interesting to look up. But we know that we want to keep a BMI above 40 is where you really run into like cardiac risk factors, high blood pressure, preeclampsia, and things like that. So most of my patients, I encourage that we try to get them below that BMI of 40 before they get pregnant.
Yeah, I mean, I see some patients for preconception consults too, and
Yeah.
so you're nice. I mean, I suggest ideally to be under 30. Again, if they're some depends where they're starting at, but again,
Yeah.
I try to counsel them. I try to get them in with a dietitian because I think that also helps. And we didn't talk anything about diet or nutrition. I think that's sure.
I wanted to, but I'm like, well, that's a whole nother lecture. Do they have data like BMI 35 in pregnancy? Does that still increase the risk of
Yeah, it's
overweight?
kind right. I mean,
Yeah. Above
with each
30.
kind right 30,
Yeah.
35, 40, the risks increase. And so
Hmm.
yeah, I think There's a lot of data on that. And so I think for non-pregnant women looking to get pregnant, we always talk about trying to institute that. Again, a lot of times when we see them,
Yeah.
they're about to go through the fertility process. So there's not really a whole lot that can actually be done unless you're seeing them like 6 months to a year before they're going to go through that. But again, I just thought I'd get your take on it. Anything that we didn't mention that you'd like to throw in here?
Yeah, I mean, I think a really important thing is that just patients exercising, they don't have to stay where they started. Like if you have someone who's more sedentary and they're just walking 30 minutes a week, and then let's say by 24 weeks they're like, "Oh my gosh, I'm feeling great. I want to start jogging." Like they can start jogging. They don't have to stay in the walking categories. So we can improve physical fitness in pregnancy. Although I always tell them like this is not a time where you're going to be reaching a PR. Like
Right,
we're
right.
not
Yeah.
PRing when we're pregnant, but you can definitely bump up, especially if you're starting from that more sedentary category. So,
Yeah, I think that's fair. I mean, I think like I go to the gym and like I don't like to do weights, but like I started doing more weights and I'm like after a few weeks I'm like, "Hey, this weight feels easy." And it's basically the same thing for pregnant
mhm,
women. Anybody is if you're doing it frequently and regularly is that you're able to increase the intensity or the frequency of what you're doing, but you don't want to get injured.
yeah. Well, that's the other last. So, like what you said, you don't want to get injured. So, we don't want to be increasing weights too fast. If you're weightlifting, you want to always lower your weights and more reps.
Great. I always ask a fun question at the end, and my question for you is favorite place to travel.
You know what? I haven't done enough traveling. I'll be honest.
All right,
I've
we
I've been
can
a nerd,
segue
but
to
I
another backup question.
well, I would say I would go somewhere with a spa. A spa and some hiking. I recently went to Sedona, and that was amazing. So I did a lot of hiking and relaxing, and that was really cool.
Okay, we'll go with Sedona as your
Okay.
favorite place. All right. Well, thanks so much for joining us. Thanks for your lecture earlier, your
Yeah.
webinar, and great speaking with you.
Awesome. Thank you.